Welcome to the deep dive. Today we're digging into something really fundamental for healthcare quality. That's internal audits and why they're just so critical for accreditation.
Yeah, absolutely. We've pulled together insights from, well, quite a few places: JCI, NABH, Supreme Medic Consultancy, iSquad, DNV, even a transcript from the QI playbook, and an article on compliance audits. So a good mix.
Definitely. And our mission for you listening in is to grasp why these audits aren't just, hoops to jump through.
Exactly. They're actually powerful tools. Tools for improving care, safety, efficiency, and ultimately they're key to getting successfully accredited.
Okay, let's kick off with a number that honestly kind of jumps out. Over 620 legal and regulatory requirements in healthcare.
Wow. Yeah.
That alone tells you why you need a system, right? A systematic way to check things. So let's break it down. What is an internal audit in healthcare, fundamentally?
Okay, so at its core, it's a systematic, independent look at how a facility is doing, checking its processes, its procedures, and if it's sticking to all those rules and standards.
Like a health checkup for the hospital itself.
Precisely. The main goal, it's about spotting non-compliance, finding inefficiencies, places to improve before the external auditors knock on the door.
Okay. Proactive.
Very much so. And importantly, it's not just ticking boxes. Good audits dig deeper. They look for those latent risks, the hidden problems in processes that could cause trouble down the line, even if they haven't yet.
So it's like finding a small crack before it becomes a major leak.
Right.
How does this tie directly into getting accredited by bodies like NABH or JCI, or meeting standards like ISO 9001 that DNV mentions?
Well, that's the direct link. For accreditation, these audits are the way you make sure you're actually meeting the standards set by those bodies.
Right.
Whether it's NABH with maybe a focus on the Indian context, or JCI with its global patient safety focus, the internal audit checks alignment. It lets you see where you stand and what needs fixing.
And how often do these happen? Is it like an annual thing?
It varies. Could be quarterly, could be annually. It really depends on the place, how big it is, how complex, what specific risks they face. There isn't a single answer fits all.
Got it. And when they do these audits, what are they actually looking at? What's under the microscope?
They look at quite a few key things. Definitely reviewing policies and procedures. Are they up to date? Do they match the standards?
Okay.
They'll assess clinical practices. How is care actually delivered? Are there risks? They check compliance directly against those accreditation standards, both national and international, if relevant.
Makes sense.
And crucially, they hunt for any operational gaps that could affect safety or quality. Breakdowns in communication, workflow issues, things like that.
Okay, so we know what they are, why they matter.
Yeah.
But how does a hospital actually do one effectively? What are the steps involved?
It's a structured process, usually. Starts with planning. You have to define the scope first. Are we looking at infection control this time? Or maybe medication safety? Or documentation?
So focus is key.
Absolutely. Then you set timelines, figure out who's doing it, you need qualified auditors, and allocate the resources needed. Good planning is essential.
Right, you need the right people and a clear map. What comes after planning?
Preparation. This is where the audit team gathers all the relevant paperwork. Policies, procedures, maybe old audit reports, even anonymized patient records sometimes.
Why?
To really understand the processes before they start observing or interviewing, you need that background context.
Okay, know the playbook before watching the game. Then comes the audit itself.
Then you conduct the audit. This involves, talking to people. Interviews with staff are common. Direct observation, watching how things actually happen. And reviewing records charts, meeting minutes, performance data. It's about gathering objective evidence.
Evidence of compliance or lack thereof.
Exactly, which leads to the next step, identifying findings. The team analyzes the evidence and figures out where things aren't quite right. These are the non-conformities.
And are all findings treated equally?
No, they're usually categorized. You might have minor ones, things easily fixed, maybe a form needs updating, no big immediate risk.
Okay.
Then major nonconformities. These are more serious. They could potentially harm patients or lead to penalties, like maybe staff consistently skip a safety check.
Right, that's serious.
And then there are opportunities for improvement or OFIs. These aren't rule violations necessarily, but suggestions for making things even better, going beyond the basic standard.
So it's not just punitive, it's also about improvement once they have these findings.
Then comes reporting. Compile everything into a clear, detailed report. Here are the findings, here's the evidence, here are the nonconformities, the OFIs, And crucially, recommendations for fixing things, usually with suggested timelines.
And the report goes to management.
Yes, and that kicks off the final, really vital step, follow-up. Management reviews the report, develops a corrective action plan, a CAP, detailing how they'll fix each issue and by when.
Do they just assume it gets fixed?
Ideally, no. Sometimes re-audits are needed to check that the fixes actually work and the problem is resolved. This follow-up part, it's critical. Sometimes it's where things fall down if there isn't strong commitment to actually implementing the changes.
That whole process sounds quite thorough. Let's circle back to why this is also crucial for accreditation specifically. You mentioned ongoing compliance.
Yes, that's number one. Accreditation standards from JCI or NABH, they're tough. And you have to meet them continuously, not just cram before the survey. Internal audits are the mechanism for checking that continuous compliance. It builds that culture.
And I guess doing it internally makes the external audit less daunting.
Hugely. If you're regularly finding and fixing your own gaps through internal audits, the external survey is likely to go much smoother. You're prepared, fewer surprises, hopefully fewer major findings from the external team.
Makes sense. But beyond the accreditation badge, how does this actually help patients?
This is the real heart of it. Patient safety and quality of care. Internal audits directly improve this. By looking closely at high-risk areas like infection control, medication safety, how care is delivered, you identify risks before they harm someone.
So safer care.
Safer, more effective care. It forces you to examine those critical processes and make them better.
It sounds like it fuels that idea of always getting better, that continuous improvement idea.
Exactly right. Continuous quality improvement CQI is fundamental to accreditation. Internal audits are a key driver of CQI. They pinpoint areas needing work, which leads to action plans, process changes, reducing errors. It's the engine for getting better.
And lastly, you need proof for the accreditors, right?
Precisely. Documentation. Internal audits create that paper trail. The audit plans, the reports, the corrective action plans, that's all evidence you show the accreditors. It proves you're not just meeting standards, but actively managing your quality and safety. It keeps you audit ready.
Theory is one thing, but do we have examples of this making a real difference, like specific hospitals?
We do. There's a good case from a hospital in Delhi going for NABH renewal.
Okay.
Their internal audit found that the infection control team was using outdated sterilization methods. A pretty big risk, right?
Yeah, definitely.
So because of that audit finding, they immediately updated their protocols, retrained staff, improved practices. They passed their NABH audit, sure, but more importantly, they seriously reduced infection risk for patients. That's tangible impact.
Wow. Okay, that's clear. Any others?
Another one involved a hospital in Mumbai seeking JCI reaccreditation. The internal audit flagged inconsistencies in how patient information was handed off between shifts.
Handoffs are tricky.
Very. It was leading to communication gaps, even some medication errors.
Yeah.
So the audit didn't just find the problem, it spurred them to implement a new standardized electronic handoff system.
Technology helping out.
Yes. And when the JCI surveyors came, they actually praised the hospital for proactively tackling that issue. They got reaccredited, again, a direct link from audit finding to improved process and successful accreditation.
Those examples really bring it home. Okay, let's zoom out a bit. We've talked JCI and NABH. What about other players like ISQA? How do these organizations fit together in the quality landscape?
Right. So JCI's mission is global, setting high standards for quality and safety worldwide. They operate in over 70 countries, accrediting loads of programs, often very patient-centric.
Yeah.
NABH is specifically focused on India, setting benchmarks relevant to the progress and context of the health industry there, part of the Quality Council of India.
Different scopes.
Exactly. And then ISQA, the International Society for Quality in Healthcare, they're more about driving improvement globally through education, sharing knowledge, promoting external evaluation. They kind of connect everyone, fostering best practices.
Interesting. And you mentioned a JCI conference, Unify 2025. What's the idea there?
Yeah, that's a big upcoming event, basically bringing people together from all over to share ideas and solutions for tackling major healthcare challenges. It highlights that collaborative push for improvement.
In JCI's international patient safety goals, those must be central to their audits.
Oh, absolutely. They target specific high-risk areas, patient ID, communication, medication safety, etc., and provide clear guidance. They're a core part of the JCI framework.
We also saw Supreme Medic Consultancy mentioned, helping hospitals with NABH. That seems practical.
It really does. It shows there's a real need for expert help in navigating these complex accreditation processes. It's not always easy for hospitals to manage alone.
And DNV's course on ISO 9001 for healthcare. Why bring in a general quality standard like ISO 9001?
Well, ISO 9001 provides a strong framework for a quality management system. Applying it to healthcare, which DNV facilitates, helps embed quality thinking not just in clinical areas, but across the entire organization, admin, support services, everything. It promotes a systematic approach.
It seems accreditation can also have softer benefits, like team building. We have some quotes here.
Yeah, those are insightful. Alex Lon in Hong Kong called their JCI journey a great team-building exercise, improving coordination.
That's interesting.
Shiji Kurian at Burjil Farha mentioned building community trust and better risk management. Imad Sadek from Emirates Hospitals talked about added value and patient confidence.
Right.
And Roxana Fulton at Corniche Hospital noted that repeated JCI accreditation shows a sustained commitment to excellence. It's more than just a certificate. It changes how the organization works and is perceived.
We've focused on accreditation audits, but are there other kinds of internal audits hospitals do?
Oh, definitely. Internal audit can cover a lot. You have quality management system audits, looking at the overall quality framework. Compliance audits, checking against laws and regulations.
Okay.
Operational audits, looking at efficiency in specific departments. Financial audits, obviously. And clinical audits, often led by doctors or nurses, evaluating patient care quality and outcomes directly.
So a whole suite of checks. That seems to make a solid compliance program pretty essential.
Absolutely fundamental. Good policies, clear procedures, regular training for everyone. And as one source noted, sometimes bringing in outside experts for a compliance check can offer a really valuable, unbiased perspective.
What kinds of things typically get flagged in those compliance audits? Common problems.
Common findings often include things like documentation gaps, not enough detail to support billing, for example. Sometimes insufficient staff training on compliance rules.
Okay.
Maybe weaknesses in protecting patient data, not doing regular risk assessments properly, or not following coding and billing guidelines correctly. These pop up quite a bit.
And it looks like tech is playing a bigger role now.
Yeah.
Software to help manage all this.
Yes, definitely. Compliance management software, like MedTrainer was mentioned, can really help. It can streamline the audit process, help keep policies current, and track staff acknowledgement, automate reporting. It can take some of the burden off and improve consistency.
Right. Okay, we have covered a lot of ground here. A real deep dive into internal audits and accreditation. Let's try and boil down the main takeaways for everyone listening.
Okay. I think the key thing is internal audits in healthcare are not just box ticking. They are absolutely essential.
Essential for what?
Essential for staying compliant with tough standards, yeah. But also for getting ready for those big external reviews. And, really importantly, for actually improving patient safety and the quality of care.
And driving that continuous improvement cycle.
Exactly, driving CQI. And finally, providing that crucial documented proof that accreditors need to see. They are foundational.
So that leads us to a final thought for you, the listener. Considering how demanding these standards are and how beneficial good internal audits clearly can be.
Yeah, the question is, how can healthcare organizations make sure these audits are truly baked into their daily work, not just something they do for accreditation every so often?
Right. How do you embed it in the culture? And are there innovative ways to get even more value out of these internal reviews to really sustain excellence long term?
It's definitely something worth pondering. How to move from periodic exercise to continuous integrated improvement.
A critical question indeed. Thanks for joining us for this deep dive.